Did you know that after 60 your body begins to lose strength and muscle mass silently, stealing your balance, mobility, and even independence? What many don't know is that this loss is not an inevitable destiny, but a condition called sarcopenia, and the good news is that you can slow it down and reverse it with simple movements from home, without the need for weights or a gym. Climbing stairs without exhaustion, standing up from a chair without difficulty, or walking with confidence are signs of functional strength that you can recover with just 3 specific exercises, designed for older adults, that strengthen your muscles, protect your joints, and give you back the security of moving freely. If you are ready to feel energy in your legs again and confidence in every step, stay because this video can make a difference in your life. Before starting with the movements, it is key to understand the importance of strengthening the muscles at this age, since, from the age of 60, the body goes through a natural process called sarcopenia, which reduces muscle mass and strength, and if not fought in time it can limit activities as simple as standing up from a chair, climbing stairs, or even walking safely. Strengthening the muscles at this stage not only restores vitality and energy, but also protects the joints, improves balance, and significantly reduces the risk of falls, one of the main causes of loss of independence in older adults. In addition, muscle training stimulates bone density, keeps metabolism active, and helps prevent chronic diseases such as diabetes and hypertension. In other words, training your muscles after 60 is not an option, it is a necessity to maintain your autonomy, your health, and your quality of life over time. And now that you understand why strengthening your muscles at this age can make the difference between depending on others or living with full independence, the time has come to take action. I will show you the 3 most effective movements, designed especially for older adults, that you can do from home to regain strength, improve your balance, and feel safer in every step you take. Exercise 1. Step Up. The step up is one of the simplest and, at the same time, most powerful exercises to regain strength in older adults. Its value lies in the fact that it reproduces an everyday movement, climbing stairs, something so common that we don't think about it until it starts to become difficult. If you notice that you lack strength in your legs, that you need to lean too much on the handrail, or that you lose balance when climbing a step, it is likely that you are losing functional strength, a vital capacity to maintain independence after 60. This exercise directly strengthens the quadriceps, glutes, hamstrings, calves, and core, essential muscles for walking, standing up, and supporting the body with stability. In addition, by working one side of the body at a time, it improves coordination and lateral stability, significantly reducing the risk of falls, which represent one of the main threats to health and autonomy in old age. What makes the step up so valuable in older adults is that it is a functional, progressive, and adaptable exercise. Unlike gym machines or routines with weights, this movement can be done at home with a simple step, firm platform, or low stair. Starting with a reduced height and gradually increasing it allows strength to be regained without straining the joints. In addition, this exercise enhances neuromuscular connection, that is, the communication between the brain and the muscles, which favors quicker and safer reactions when walking or changing direction. In practical terms, it means being able to get on a bus with agility, cross a street safely, or stand up firmly after sitting. Training this movement is training for real life, strengthening not only the muscles but also confidence and daily independence. Science widely supports its benefits. A study published in the Journal of Geriatrics showed that older adults who performed step-ups 3 times a week for 8 weeks achieved significant improvements in strength, balance, and mobility, as well as feeling safer when moving around. Another trial, published in Archives of Gerontology and Geriatrics, found that this exercise notably reduced the test time, a key indicator to measure speed and risk of falls in sedentary older adults. This means they not only gained leg strength but also greater speed, stability, and control of their movements. From a biomechanical perspective, this exercise recruits type 2 muscle fibers, responsible for power and explosive movements, which tend to atrophy faster with age. In addition, it strengthens the gluteus medius, an essential muscle to keep the pelvis stable when walking and to prevent falls. For all these reasons, the step up is one of the most recommended exercises for people over 60 who seek to regain strength, balance, and safety in movement. Exercise 2. Side plank. The side plank is one of the most complete and effective exercises for older adults who want to strengthen the core and regain stability. Unlike the front plank, this variation focuses on the oblique muscles responsible for torso rotation, postural alignment, and lateral balance. These muscles often weaken with age without us realizing it, until one day it manifests as stumbling or falls to the sides, one of the most common and dangerous in people over 60 years old. By performing the side plank, the body is forced to deeply activate the stabilizing muscles of the hips, abdomen, and spine, which not only improves trunk strength but also coordination and neuromuscular control. This translates into greater safety when walking on uneven surfaces, when turning abruptly, or when reacting to an unexpected imbalance. From a scientific perspective, the side plank in older adults has shown great benefits for fall prevention and midsection strengthening. A study published in the Journal of Strength and Conditioning Research revealed that isometric exercises, like this one, not only increase the strength of the obliques, but also improve postural endurance, that is, the ability to keep the body aligned during movement. This is fundamental because many falls do not occur due to weakness in the legs, but due to poor management of the center of gravity. In addition, the side plank protects the lumbar spine by promoting a neutral alignment of the body, reducing pressure on the lower back. For this reason, it is considered a safe and effective alternative even for people who suffer from lumbar discomfort, as it strengthens without generating impact or compression. Performing the side plank correctly is simple and highly beneficial. To begin, support yourself on the forearm and the side of the foot, forming a straight line from the head to the heels. Keep the abdomen engaged, avoid letting the hip drop, and hold the position for 10 to 30 seconds per side, repeating 2 to 3 times according to your ability. Thanks to its isometric nature, this exercise strengthens the muscles progressively without damaging the joints, which makes it ideal for older adults or people in rehabilitation. By including it consistently in your routine, you will not only strengthen the core, but also gain better posture, greater control in everyday movements, and more confidence when moving, essential pillars for maintaining independence, safety, and quality of life after 60 years old. Exercise 3. Child's Pose. Child's pose is one of the most restorative and accessible movements that exist, and it is especially beneficial for older adults over 60 years old. Although at first glance it looks like a passive position, sitting on the heels, leaning the torso forward, and extending the arms, its impact goes far beyond relaxation. This exercise relieves compression in the spinal column, relaxes the lower back, and gently stretches the neck, shoulders, hips, and knees, areas where most stiffness tends to accumulate over the years. In addition, it helps release physical and mental tension, acting as a reset that improves joint mobility, flexibility, and body awareness. Practicing child's pose regularly allows muscles to rest, joints to regain mobility, and the body to feel lighter and more functional in daily activities. From a scientific perspective, child's pose in older adults has benefits that go beyond the physical. Studies published in Spine Journal have shown that this type of restorative movement reduces blood pressure, lowers cortisol levels, and promotes activation of the parasympathetic nervous system, which helps control stress, improve sleep quality, and increase the feeling of overall well-being. Physiologically, this exercise produces gentle traction on the spine, which decompresses the intervertebral discs, making it ideal for those who suffer from lower back pain, chronic stiffness, or spinal stenosis. In addition, by working hip flexion and thigh stretching, it promotes the mobility of one of the joints most prone to deterioration with age, the hip. Keeping it flexible is essential to walk safely, lift the legs firmly, and prevent falls. One of the most valuable aspects of child's pose for the elderly is its adaptability. It can be practiced on the floor, on a mat, or even in bed, making it an inclusive movement for people with different levels of mobility. If there is discomfort in the knees, cushions or blankets can be used to support the body. If it is difficult to rest the forehead on the floor, a yoga block provides the necessary elevation. The important thing is to maintain deep and conscious breathing, allowing each exhalation to release accumulated tension. By dedicating just a few minutes a day, this pose not only relieves the body, but also connects the mind with the breath, promoting a state of calm and regeneration. Including child's pose at the end of a strengthening routine is like giving the body a perfect closure, relaxation, flexibility, and renewed energy to move with more confidence and well-being each day. Exercise 4. Glute Bridge. The glute bridge is one of the safest, most accessible, and most effective tools for older adults who want to strengthen their body without damaging their joints. This simple movement, lying on your back, with knees bent, feet firm on the floor, and lifting the pelvis upward, activates at the same time the glutes, lower back, hamstrings, and deep core, especially the transverse abdominis, a key muscle in spinal stabilization. Why is it so important? Because after 60, the loss of muscle mass and sedentary lifestyle cause these areas to weaken, increasing the risk of falls, chronic lower back pain, and loss of postural balance. The glute bridge works as a rescue for those forgotten muscles, restoring strength, stability, and body control. Science fully supports its benefits. Research published in the Journal of Back showed that older adults who performed glute bridges 3 times a week for 6 weeks reported a notable decrease in chronic lower back pain, along with significant improvements in strength, endurance, and postural control. This happens because by activating the glutes and core, the body redistributes biomechanical loads of the pelvis and spine more effectively, reducing pressure on the lumbar vertebrae and improving pelvic stability. This means that daily tasks such as walking, climbing stairs, standing up from a chair, or carrying weight become easier, safer, and more efficient. In addition, when performed in a controlled and conscious way, the glute bridge promotes diaphragmatic breathing. Inhaling while lowering the pelvis and exhaling while lifting it enhances muscle activation and improves body-mind connection. The most powerful thing about this exercise is that you don't need equipment or a gym, just a mat or even a bed to start. You can begin with 2 or 3 sets of 10 to 15 repetitions, resting between each set, and progress little by adding more repetitions, elevating the feet on a surface, or even holding the position for several seconds at the top. Its low impact makes it ideal for any fitness level, and its benefits go beyond muscle strengthening. It improves posture, protects the lower back, increases confidence when moving, and contributes to maintaining physical independence after 60. Including it in your regular routine is betting on a stronger, more stable body free of limitations, a true ally for aging with energy and vitality. Before starting any training program, it is essential to understand that the glute bridge is not just an aesthetic exercise to strengthen the glutes, but it represents a key piece in the body's overall health. The hip and glute muscles fulfill a stabilizing function that directly impacts posture, protection of the lower back, and efficiency of daily movement. In fact, multiple studies in biomechanics have shown that strong glutes reduce pressure on the spine and knees, helping to prevent injuries and chronic pain that often appear with age. As the years go by, many men and women lose muscle mass in the legs and hips, creating imbalances that affect mobility and independence. The glute bridge, by focusing on these muscles, not only strengthens the area but also activates the deep core muscles, generating greater body stability. In addition, this exercise has a positive impact on functionality and physical performance. Glute weakness is related to limitations when walking, difficulties climbing stairs, or even loss of power in sports activities. The glute bridge, being a movement that can be adapted with weight, resistance bands, or support variations, allows for constant progress, increasing strength, endurance, and neuromuscular coordination. Furthermore, research in physiotherapy highlights its usefulness in rehabilitation processes, especially in people who suffer from lower back pain or hip problems, as it helps retrain weakened muscles and improve muscle activation that is often lost due to a sedentary lifestyle. Added to this is the fact that it is a low-impact exercise, which makes it accessible to people of any age, including those over 40 who seek to train safely without compromising their joints. Finally, we cannot forget that the glute bridge also has a strong role in preventing physical aging and improving overall well-being. By activating large muscles such as the glutes and hamstrings, it stimulates greater energy expenditure, which promotes fat loss and optimizes metabolism, something crucial in adulthood, when metabolism tends to slow down. In addition, strengthening the hips and lower body translates into a lower risk of falls, greater reaction capacity, and better balance, vital factors for maintaining independence in advanced ages. Even on the mental side, practicing this exercise regularly reinforces confidence in one's own body, since the feeling of strength and control generates security and self-esteem. For all these reasons, the glute bridge must be considered much more than just a simple movement within a routine. It is a powerful tool to prolong mobility, protect health, and maintain an active and fulfilling lifestyle at any stage of life. In this way, if this content was of great help to you, we invite you to like this video, subscribe to the channel, and activate the notification bell, since it will surely be of great help to us. Your body and your health will thank you. Thank you for watching this video and see you soon.